The emergency department is in many ways the face of the hospital. I think people are attracted to emergency medicine because it's a real opportunity to make a difference. My name is Glenn Bandiera. I'm the Chief of Emergency Medicine here at St. Michael's Hospital. We see about 200 to 230 patients a day, and each of those patients requires multiple decisions during their stay. Each of these individual decisions will generate cost. We wanted to get a sense of how aware people were of the costs of medications used in the emergency department. So we ran a contest. We just asked them, what do you think the annual cost of these medications are in our emergency department? And people didn't do very well. We realized that people are not very cost aware. For example, two simple antibiotics for urinary tract infections, one of them is nitrofurantoin and the other one is cotrimoxazole. And they were both very effective. The nitrofurantoin is about $7 a course and the Cep is about 30 cents a course. So there's about a 20-fold difference in the cost between these two drugs, and over the course of a year you can imagine what an impact that would have. So I think doctors have a social obligation to consider the costs of the treatment that they recommend. Our obligation is obviously to give the best care we can to an individual patient, but when there are a number of ways to get where you want to go and they're equally effective, then I think cost should be one of the considerations.
St. Mike's was founded in 1892, as we all know, by the Sisters of St. Joseph, and we've had a fabulous tradition of providing care through the ages. Now we have a new challenge. My name is Anne Trafford. I'm the Vice President of Quality and Performance at St. Michael's Hospital. Our province is under tremendous financial challenge. Health system spending is the #1 expense on the provincial budget. It's not sustainable to continue to increase that funding, and so the ministry has actually developed a new way of looking at how hospitals and other providers in the health system are funded. As a leader in healthcare in Ontario, St. Michael's has to be part of the change, and that means that every single one of us, all 5,600 staff, physicians, residents, volunteers have a role to play. Our financial fluency program is one way that we're going to start to help you understand how you can contribute to the changes that health system funding reform is bringing to us as an organization. In the cath lab, they've had great success in working with their frontline staff to organize their supplies, to make decisions about the supplies used in a very different way.
It was really important to work with clinicians and frontline staff to ensure that they have the right product at the right time and the right quantities available to them to do the procedures. My name is Victoria Buchek. I'm a clinical lead and manager in the cardiac cath lab at St. Michael's Hospital. We had a lot of product on hand and we didn't really have a way to standardize the variety of products that we had. We had also a lot of wastage. Our wastage for last fiscal year was just over 100,000. This was a perfectly good product that we could have used, but it wasn't used in time because of the way we stored it in the lab. The wastage was happening mainly because the product wasn't rotated as it should have been. So same as in the grocery store, you see a milk that is close to expiration in front of you. Our catheters, for example, were stored at the back. Supplies that are close to expiration have typically a use first sticker, and it's just really a visual aid to remind staff that this product needs to be used first.
This is a conversation that needs to be ongoing in the hospital. I think there are lots of opportunities to improve our cost awareness, improve efficiency, and still deliver very high quality care.
Delivering quality care is our top priority, remains our top priority. We're all accountable. And this is the beginning of a series of conversations.